Evening, good evening, everyone,
Evening.
and welcome to my first JCC chairing. I will give you a brief update about myself. My name is Marcy Skeet. I've been a counselor for the past 6 years, and luckily, I was also the mayor of Merton for 2017-2018. I worked with underprivileged people in the prison for 10 plus years. So I think that I'm the person to work with you and the JCC group to address at least a few of your problems and we can solve them collectively. This is my first cabinet post, so I am looking forward to working with you and we can work collectively for the betterment of the JCC. That's about me. Please indicate by using the chat option or raise your hand option, and please refrain from disturbing anything because we want to finish by 9 o'clock. So no cutting in and talking and all of that, all right? Now let's look at declarations of interest. Are there any declarations of interest? Okay, apologies for absence.
We've got apologies from Salim Sheikh, also Mr. Islam and Slavik.
Okay.
I'm not aware of any other apologies.
Okay. Minutes of the previous meeting.
Hello.
Sorry?
From my side, Dr. Aru couldn't attend the meeting. Chairman of the South London Town Welfare Group.
Okay, thank you.
Thank you.
Right.
Okay. Any matters from the meeting?
The main matter arising at the last meeting, Barry Causer from Public Health undertook to share data around the breakdown of ethnicity of the COVID-19 victims and so forth. But Public Health England is still doing the number crunching, and so locally they're still working on it. And he's informed me that the data will be ready soon. As soon as it is, I will share it with the JCC.
Okay, thank you. Anything else?
And
just to note that I was present at the last meeting and my name doesn't appear in the list.
I'm very sorry, Bishop. I'm very, very sorry. So I'll amend
Your
the
name will
minutes.
appear
Well.
next meeting. Don't worry. Everett, you're about to say something else?
As soon as I saw Bishop Copeland, I thought I missed you off the minutes. So that was it. Thank you.
Okay. Anyone else? Okay, without any further ado, we'll move on to Stay Well in Winter with Nathan.
Thank you. Thank you. I'm going to try and share my screen. Hopefully I won't have any technical issues. Can you all see the screen now?
Yes.
Yeah, perfect. I don't know what's happened, but I can't see you. So please do let me know if you want me to stop at any point. So I'm in Nathan. I am the engagement manager for NHS Merton, and that's the South West London Clinical Commissioning Group. So I just wanted to come along today to talk to you about how we can stay well during winter and how you can continue to access local NHS services, but also how we can further reach our local communities. So I just wanted to start. See, my first technical difficulty, it won't change the slide. There we go. So I just want to start on the flu vaccine. So we know that the flu kills on average 11,000 people per year. But because of the COVID-19 pandemic, it's even more important this year to make sure that we are vaccinated against the flu, protecting ourselves and our families. So one of the things that we wanted to do is come along today to raise awareness about the flu vaccine, make sure you know, we've heard about lots of myths. So we just wanted to make sure you know the facts and you can share this with your networks. So this year, the flu vaccine has been offered freely to more people than ever before. So it's I've listed it here, but it's adults aged 65 and over, people with long-term medical conditions, people who have a learning disability and their carers, pregnant women, children aged 2 to 3, frontline health or social care workers, people who are on the shielded list, and this year it's also those that are aged between 50 to 64. So if you fit into any of these categories, you can freely get the flu vaccine at your GP surgery or at your local pharmacy. But if you don't fit into this category, it is very affordable, and you can go to the pharmacy or GP practice to get it if you would like to. So I just wanted to quickly, and I'm going to go through these very quickly so that we can move on to a bit of a discussion. But one of the things that we've been hearing quite frequently, this is one of the main myths that we've been hearing, is that the flu vaccine can give you the flu. That's not true. The flu vaccine can't give you the flu because it's made with an inactivated version of the virus, so it's not capable of giving you the flu. The second myth is I had the vaccine and still got the flu, so it doesn't work. There are several versions of the flu virus that are circulating, and this vaccine does help protect you, so it improves your chances of being protected from the flu, but it doesn't mean that you might get another strain. So that's something to keep an eye out for as well. Myth 3 is that I'm pregnant, so shouldn't get the flu vaccine. This isn't true. It's really important for pregnant women to get the vaccine, and it's safe at any stages of pregnancy. Myth 4, the flu vaccine is linked to COVID-19. Again, that's untrue. The flu vaccine does not contain COVID-19 or the flu, as I've said before. Vaccines are all made using tried and tested methods, and the COVID-19 virus is caused by the novel 2019 coronavirus, so they're not linked at all. And lastly, this is also a very common myth that we've been hearing, and it's about the ingredients that the flu vaccine contains. So people saying that the flu vaccine contains ingredients that I can't have. So just to cover pork gelatin, do all of the flu vaccines contain pork gelatin? No, they don't. There are two main types of flu vaccines that are available, and the injectable flu vaccines do not contain pork gelatin, but the nasal spray vaccine, that's mostly for children aged between 2 to 17, that does contain pork gelatin. And also we've been, this isn't covered in the slide, but we've also been asked about egg allergies and whether you can have it if you have an egg allergy. You can have it, but it's dependent on your GP at what setting you have it. So if you have a low allergy, you might be able to get it at your GP surgery, but if you have a very severe allergy, you might have to get it in a hospital setting to make sure that the right healthcare is available for you when you do have the vaccine. So for each of those myths, there's lots more information within the slide decks. So how can you access the flu vaccine? You can access it at your GP surgery or at a local community pharmacy. And there's a link there, myvaccinations.co.uk. And you're actually able to use that link to find your local pharmacy. That's providing that's providing the flu vaccine. But not all pharmacies are giving the flu vaccine. It's an opt-in process, so it might be that your local pharmacy is not doing it, so just check and make sure that the pharmacy that you're going to is providing the flu vaccine. So we have been hearing about supply issues, and we've heard that demand has outstripped supply, so people are being turned away. But we do know that the government has released extra supplies to meet the demand. So if you previously went and you were turned away because you weren't able to have one, it might be now that the GP and also the community pharmacy do have stock. So please try them again. So how can you help? We've developed a toolkit that you can share with your community members, your networks, your friends and family. And it basically has lots of assets that you can use on social media, on newsletters. There's leaflets and posters as well. And there's myth-busting material to go through some of the myths that I've already been through with you, but in different formats. And we've translated these materials in 8 different languages. So please feel free to share these with your networks. But also what we're trying to do is we're trying to reach out to as many of our community networks as possible. So we're going to coffee mornings, We're going to community forums, to meetings. So for example, we've met with Age UK, Merton Centre for Independent Living, Merton MenCap, lots of different organisations, to go through the slides that I've shared with you and just have an overall discussion on winter. And we want to make sure we're reaching as much of our community as possible. So if you have any ideas, or if you have a way into your community groups, it would be really great if you could link us up. We also thought it'd be really helpful to talk to you about the NHS is Here For You campaign, and make sure that everyone knows that our GP surgeries are open and that you can access healthcare settings. So we know at the very beginning of the first lockdown, when the COVID-19 pandemic started, that people were afraid of going to their local healthcare settings for fear of getting it, and they weren't sure about what we were doing to make sure that they would stay safe. So this slide just is to reassure you. It just kind of goes through the different things that our healthcare professionals are doing to keep you safe. So there's the 2 metre social distancing. There's longer time and spacing between patients. There's specific areas that are just for COVID symptoms, so that you're not always in contact with them. There's infection control and cleaning that's going on in all of the GP practices and different healthcare settings as well. There's personal protective equipment for staff and our patients. So if you've been to a hospital recently, you might have experienced at the door, they're handing out masks to patients that don't have them, or to staff that don't have them, making sure that everyone's got the right equipment. There's testing and temperature checks in place. And of course, all of these arrangements are dependent on the site that you're visiting. And there's also clear instruction about where to go on arrival, to make sure that you're not stuck anywhere longer than you need to be. I've also included a link here to the Merton NHS is Here For You video. That's Dr. Mohan Sekram just talking and reassuring you about the local healthcare settings and the GP surgeries, telling you that they're open, to give that a watch as well. And you can share that. So this slide kind of contains some health tips about winter. So just to run through them, and it's advice to make sure that you're keeping well during the winter weather. So it's really important to wrap up warm when you go out and make sure your shoes have good grip. Wear multiple layers of clothing when you can, rather than a single bulky layer, to make sure that you're retaining your body heat. Have at least 1 hot meal a day and try to drink hot drinks regularly. Use a hot water bottle or an electric blanket to stay warm, but not both. Make sure you're receiving all the help to heat your home that you're entitled to. And I'll talk to you a little bit later about the different places that you can go to get that support. And it's really important to keep an eye on our elderly relatives and our neighbours to make sure that everyone's feeling supported during these winter months. So there are lots of places that we can go to make sure that we're getting the medical advice that we need. And this just signposts you to the different settings. So firstly, self-care. You can make sure that your medicine cabinet is well stocked at home. And I'll share some links with you a bit later on that shows you NHS guidance, and it details the different things that you can keep at home. For example, ibuprofen, paracetamols, antihistamines, and it's making sure that you're not allergic to these medications, but it gives you a list to say what you might want to keep at home. The pharmacies available for any advice on ailments and medicines and healthy living. There's the NHS 111, which is a service that you can call for free, open 24 hours a day, 365 days a year. You can call or you can access the service online. And I'm going to talk to you a little bit in more detail on the next slide. As I've mentioned, the GPs are still open. So you can call your practice or you can visit their website to make an appointment. And 999 is there to call for any life-threatening emergencies only. So just building on NHS 111 first, I'm sure you've all heard of it, but if you haven't, it's a point of contact for medical help and advice that you can get over the phone or via the website. It has staff that have been trained to healthcare advisors, including doctors, nurses, GPs, paramedics and pharmacists. And they run through a list of questions with you, excuse me, to try and get an understanding of your symptoms and what could be wrong, and they signpost you to the best possible place. We're trying to avoid our A&E waiting rooms being really busy now, so you're not waiting around unnecessarily. So we're trying to encourage people to call 111 first, unless they've got a life-threatening emergency that they need to go to the hospital for. So this means that if you call 111, they can book you an appointment on the same day at A&E. It means that you don't have to wait around and you can get seen to straight away. If you don't need an A&E, they can book you at the GP, for an emergency dentist, to speak to someone about your mental health support, book you into any other NHS services, so you can still get the help and support that you need. Sorry, I'm just losing my voice. So this is the slide that I was talking to you about making sure you're well stocked at home. So there's the NHS site link here, but there's also some information that our colleagues at the South West London CCG have written about managing your medicines during the COVID-19 pandemic, and that's specifically for patients. So there's a few different sites here that you can look to for support. You can also speak to your local community pharmacist for any help or support. And there's also an email address to the medicines optimization team. So you may have all heard about the Warm and Well in Merton campaign, and it's a partnership campaign between Merton Council. Sorry, I'm really losing my voice today. Wimbledon Guild, Merton Age UK, and a not-for-profit organisation called Thinking Works. So it just breaks down the 5 things that they're talking about throughout this campaign. There's online talks about keeping warm and well. There's energy saving advice, and that's you can contact Wimbledon Guild. It's free advice. They talked about grants that you might be eligible for insulation and heating. There's information and advice from the Age UK, again, free confidential advice. Financial support, so again, about if you're eligible for grants to do with fuel costs, bedding and food, and again, that's Wimbledon Guild. And for those that are age 65 or with a long-term health condition or a disability, you can actually get support from a handy person, and you'd have to contact Wimbledon Guild for that as well. So the last couple of slides are just really to gather your thoughts. So I'm going to stop speaking now. You've probably heard enough of my voice. And it's just to kind of talk to you a little bit about whether your community, whether you know if your communities have had the flu vaccine, if they face any barriers, how we can reach more of our vulnerable community members, and also any thoughts that you might want to share about how people are preparing for winter, if they've accessed the NHS healthcare settings during COVID-19, and any thoughts about 111. So it's just up for discussion now. Everett, would you like me to stop sharing the screen while we have a discussion, or would it be easier to leave?
Yes, if you could stop sharing your screen, that would be helpful, because people do have it in the packs and the electronic version. Thank you.
That's all right.
Does anyone have any questions?
If you don't have any questions, it's just really an ask. And if you've got any coffee mornings or community settings that we could come to talk about winter, then we'd love to come along. So it's just, we just need an in, really.
I've got a question, please.
Hi.
Hi. Everett, can I speak?
Yes, Councillor Skeet, if you could just get everyone to introduce the speaker, that's fine. But go ahead, Joan.
Right, okay. Good afternoon, everyone. Sorry to be late. I was on another Zoom meeting. Okay. My question is, I am 67 years old, and I am not showing any symptoms of COVID-19. However, what I learned and what I read, it can be very silent within my body. And I went to one of the testing center, which is very nearby me, 2 minutes walk from my house. And I explained, and I was told that I have to have symptoms like possible constant coughing, fever, feeling. you know, and, you know, listening to the news, sometimes it's not, what am I saying now, you know, straightforward, because what we learned that it can be silent within your body and you don't know about it. So if it's very silent, why are they refusing us having a test? That's my question.
Thank you for that question. And that's regarding a COVID-19 test.
Yes, yes, thank you.
I'm not sure about that. I can definitely take that back. Could it have been due to the stock that they had at the time?
Right, I would like you to take it back, because I mean, people like me, you know, I would like to know, because I like to get a test to find out what. I don't have to be falling over or wait until I'm drop dead before they do the test.
Absolutely, I can take that back.
Thank you. Amanda, if you get a response, if you share that with me, I can then share it with the JCC. So thank you.
Yeah, I can do that with any questions, absolutely.
Councillor Akagino?
Yeah, thank you. It's just a comment, really. You were talking about if people wanted to know if the allergy with the eggs, and you made a statement that it depends how bad it is, and if it's okay, you can go to your GP, but if it's bad, then you go to the hospital. I don't think you should be telling people that, because you put people off. I mean, if you were to say that to me, I would certainly not go to the hospital, because I think something might happen to me. So if you want people to have the flu jab and there's, you know, they're allergic to it, you have to explain it to them properly so they have a choice. Because the way you said it, I would definitely not go and have a flu jab if I'm going to end up in a hospital just to have a flu jab. Okay, it's just a comment, really.
No, that's a really helpful comment. Thank you for sharing that. That was just based on one of the outreach sessions that we did recently, and they felt that they didn't know if they had an egg allergy, if they could have it or not, and they were just put off. So that was the pharmacist's advice in terms of you can have it, but it's a conversation with your GP about the best setting for you. But I do take that on board. Thank you.
Aman, it's Logie here.
Hi, Logie.
I have come across a lot of people who are shielded people who are still not got the flu injection because they're scared to go and see a GP practice. How can I help them?
So we are looking at different ways that we can get the vaccine to them. I don't think there's a particular way yet. There are community clinics.
Right. Okay.
So when we have more information about that, I can share it with you.
Thank you.
Excuse me, Ranjit, you trying to speak? I'm not sure. Sorry, Councillor.
Hi, everyone. Thank you. Sorry for turning up slightly late today. Internet issues, as ever, with the digital age that we live in. Aman, thank you very much for the presentation. It was very useful and insightful. Could I commend the work that you're doing? And obviously, I think it's good to kind of spread that message. Could I ask if you could forward on the presentation to all the councillors if you haven't done so already, just because I think it'd be useful, especially for myself as a councillor. There's local groups that I think could benefit from that presentation and kind of forwarding that on. And I think the other councillors will be more than happy to kind of have that so they could forward on to their local contacts and groups as well.
Absolutely, that'd be really great. Thank you.
Thank you.
I have the presentation, so I can share it with all councillors, unless you want to amend it, Aman, but if you're happy with it as it is, I can share it.
Yeah, that's absolutely fine.
I can do that.
Thank you.
But this is already in the minutes of the meeting, isn't it? You send everything, the presentation already there anyway.
I did send it out, but it doesn't go to all councillors. It goes to the councillors on the
Okay.
JCC, so I will send it to all councillors.
May I ask a question, please?
Certainly.
Right. Hello. Thank you, Aman, for your presentation. Quite thorough. Just a quick question. You did say that there are packs around, but as I'm not a councillor, how do I get access to particularly the last page that has 5 local community groups, age concern, etc., that we can share with others so they can access particularly the grants and other things that may be of benefit to community members?
Sorry, Sharon, if you message me privately with your email address, I can share that with you.
Okay, thank you.
Okay.
Thanks,
Thank
Emre.
you.
Okay. Councillor Skeet, perhaps we move. If there are no more questions,
Are
perhaps.
there any other questions? Okay, we will thank Amal for her presentation. Thank you very much for coming and sharing your very valuable information with us. And we'll send you the information you need if we have any information, any queries that we have, anything unsettling, we'll contact you. Thank you very much.
Thank you very much, and thank you for having me today.
Thank you. We'll move on to the police update. Inspector Bob Whitehead.
Okay, good evening, everybody. Thank you for welcoming me to this fine and exciting meeting. You've got the pre-pack, which I provided to everybody, which has a number of different bits of numbers and various bits and pieces. I'll go over that very quickly and then take any questions. The short version is some types of crime are up, some types of crime are down. Burglary has been significantly down due to predominantly COVID. More people are working from home, more people are spending time at home. I'd love to say most of that is down to police action. It's not, it's due to changes in the way we act and the way we are. Certain types of crime are up. Theft from motor vehicles, theft of motor vehicles are up a touch. The theft from motor vehicles is predominantly aimed at things like theft of catalytic converters, which has been a significant increase over the last year and is causing us some problems. We've moved a number of officers out of Earlsfield Police Station into Wimbledon Police Station, so we've got an increase in the officers out of there. I'm hoping that at some point in the future that's going to see it lead to a significant improvement in our response rates and with resources across Merton. There's no significant update on Wimbledon Police Station. That's waiting for the Mayor's office. My staffing for the neighbourhood officers is very good, but we've got a lot of officers who are coming into the stream who don't have that much experience, so it will take time to get them all up to speed. There's been a couple of very high-profile incidents that have happened over the last few months. These include the male murdered and set on fire. He was set on fire in Mitcham Common, but probably not murdered in Merton. The Morden murder and the attack on the young girl on the way to school. The primary suspects for all of those offences are currently in custody, and we hope we'll be spending awful long time at Her Majesty's pleasure. That's the main points I'm going to mention. I've also taken the liberty of inviting Seema Shah to this meeting. One of the mayoral targets that he's just released is to increase the number of BAME members of the police service. He set targets of 20% by 2024 and 28% by 2030. One of Seema's jobs is to assist people who are from a BAME background to both look at recruitment and help people into joining the job in various different forms. So at the moment we have 15.7% BAME out of our police officers. That's something that we're looking at significantly increasing, and we would obviously look for this panel's assistance with that. But I'm now going to introduce Seema to come in for a couple of minutes and just say what she does and what she can provide and how we can help each other.
Thank you very much, Bob. Good evening, everyone. I hope you can hear me. So as Bob alluded to, my name is Seema Shah, recently appointed with the Met Police as Outreach Recruitment, and I'm delighted to be here taking a couple of moments of your time. I'm just going to talk about the pathways to the to the recruitment process in line with our organisational objectives of increasing underrepresented groups as it relates to Black ethnic minority and Black ethnic minority attainment within our communities to ensure that they get the right start with our apprenticeship programme. So in sum, we have, for people who do not have a degree, we have a 3-year, fully funded by the Met, apprenticeship programme. And the basic requirement of that is to have at least GCSE in English as a C grade. That's the minimum. And if they don't have GCSE in maths, we could support them in the first 2 years of the programme. That's a fully funded degree apprenticeship programme. The starting salary from day one as a police constable is at 30k, £50 shy than 30k. Then we have another pathway for police constables who do, for candidates who wish to pursue a career with the Met Police as a police constable, a 2-year programme. And that's sort of an 80-20% split within 4 London colleges, 4 London universities, I beg your pardon. I can go into greater detail about the various many pathways that we do have to engage as employees with the Met Police. We've got wonderful volunteering opportunities in terms of specials, and that's something on some of the community groups that I've sat in on. Members of the community have been quite interested in joining, and there's lots of opportunities there. Again, I can drill down on that more specifically, perhaps in taking up one-to-one discussions or umbrella groups for the BAME strand here within our communities, and we can sort of finalise details as to when and how and where we can meet to ensure that we cascade sort of apprenticeship and job opportunities to our communities, teams and networks. I hope that's fair enough to say that amount of information now, but to say that there is plenty of opportunity, and I hope to be working with you very closely and ensuring that we in the Southwest are really making a big splash on some of the organisation and mayor's objectives for BAME recruitment with the Met Police. Thank you.
Okay, thank you, Seema. I'll now take some questions. If anybody's got any questions directly to Seema, they're welcome to ask her directly. Otherwise, I'm happy to take any questions about the policing side of things.
Yeah, can I have a question?
Yeah, I'd like
please?
to ask Seema.
Yes, please do. Hello.
It's me, is it? Yeah. Yeah, on this presentation you gave, I don't really see anything about the scam crime. Have you got any figures on scam crime in Merton?
What kind of scam crime? I don't have it off the top of my head. I mean, there's obviously both scams. There's the number of deceptions that have actually occurred. I don't have that data immediately available. I can dig it out at some point.
Okay, we can send it to Everett, please. Thank you.
Yeah, sure.
Thank you.
Okay. Hello, it's just a question from
Yes.
Hannah here. It's good to see that you're increasing the numbers of BAME police, especially in London and certainly within the southwest of London. But what plans have you got to guarantee that these officers have the support that they're going to need so that they're not targeted by criminals in the borough?
Bob, do you want to come in with some of that? I can deal with the recruitment side.
I mean, if you start your bit and then I'll come in.
Yeah. So that's a good question. Thank you very much. And as I've mentioned, I can deal with the recruitment side. The focus will be that Black ethnic minority candidates from our communities will be fully supported in the various different pathways, sort of the apprenticeship pathways or the degree holder programme. So in relation to the broad spectrum of support, that they will be supported in their application and certainly as they progress in their academic apprenticeship career. But then I think the other strand to what you're saying is, when they become fully qualified as police officers, how are they supported? In which case, could I hand over to my colleague Bob to perhaps address that? Thank you.
Yeah, I mean, we obviously look to support all of our colleagues. There are a selection of assistance groups and support groups for our BAME colleagues. We also have a BAME help group with Southwest to support each other. There's a selection of opportunities and assistance that we can provide. Unfortunately, people do get targeted, especially by other members of the BAME community. They're the ones who I always feel the most concern for, events like Notting Hill Carnival and at various demonstrations. My BAME colleagues are the ones who get the most targeted abuse by BAME people. The abuse some of them get is just scary. Unfortunately, it's something that we're working very hard to try and support, protect, provide assistance to. We're obviously targeting anybody who does commit such offences, and we use things like the body-worn video to try and target people and support them in any way we can.
Good. Can I ask a question to Seema, actually? Seema, since you're trying to recruit BAME groups to become PCs, and what have you found is stopping them from joining? What are their fears, and how are we going to try and overcome their fears to see if we can get more of them? And what support are you going to give them in that aspect?
Okay, well, to address your third point, the support will be in line with any sort of, for example, if they lack a qualification, say, as I've mentioned before, a GCSE in maths, for example, in the first 2 years of their degree program, there will be such a thing as functional skills. Can everyone hear me? I think I've got an interruption with my connection.
Yes. Yeah, I can hear you.
Carry on. So there is academic support there, and from day one, thank you very much for confirming that. And from day one, when they are on the programme of higher education, including the apprenticeship, they will have support amongst their team. That will be divided as appropriate and as discussed with perhaps their learning manager as well as their line manager. Well, we want to ensure that transition into really ensure that they have the best possible. And also, I would say actually that have the equality strand, including LGBT and women, and I'm a member of the Women in Policing group as well. So there are sort of associations, if you like, and strategic meetings that really critically and honestly look at ourselves as an organisation about how best we can improve. Again, I can only speak on the recruitment side in terms of attainment to these higher education programs and sort of promotions and opportunities around promotion. Over more than that, you know, I'm newly employed, so you know, I know as an organisation this is a very hot topic, and I'm most pleased to see that recruitment and the recruitment of ethnic minorities as an underrepresented group is very much in the focus. And I think what's very important for us in the Merton area is to ensure that we have links between us and we can pursue vigorously and strategically about how can we re-engage in our communities to ensure that they are thinking on the lines of the Met is a viable option for them as a career option. I'd like to work with you very closely on that.
Okay, well, what I really wanted to know is if having spoken to a few, do you know what their fears are about joining the police force? I know you want us to help you in the community talk to people, but have you found out, if you've spoken to a few, what their fears are for joining, apart from being attacked or whatever, and apart from maybe...
I think really I'm embarking my journey with my external stakeholders, and I'm not going to make any assumptions. I think it's a matter of when I'm with my partnerships, I'm preparing as we speak actually a presentation tomorrow for my my job broker partnerships to really understand. I make no assumptions about that. I wouldn't want to do that. So unfortunately, I don't have an answer with you on that in the here and now.
Okay, thank you.
Thank you.
Hi, my name's Debbie Allen. Can I ask a question?
Go on, Debbie.
Thank you so much. My experience of what I've seen, I work in a community centre, and I've seen the young black boys actually harassed by police officers regularly. So I'm curious as how you would change that narrative, because what you're saying at your level is actually not filtered down on the ground for officers to treat young people with respect so that they would want to go into that choice of career. I'm also curious, as I've done many community events, and I usually invite the police to come along with their recruitment stand, and nobody's ever come. They watch me from afar and let me get on with what I've got to do. But I think you guys have to try a different approach. Even give Carnival as an example. Instead of having a whole load of officers looking very like security as you go into Notting Hill, why not set up recruitment stands there and just, you know, make it a little bit more welcoming?
Okay. We do recruitment at Carnival. That is one of the things we do, but I appreciate the perception of us is quite aggressive. I've worked an awful lot of carnivals myself in various different roles. One of my biggest concern is the number of people who get injured and the number of weapons offences that are caused and are committed within the carnival footprint. So there's normally reasons behind the number of police officers we have in that immediate area. I've seen a number of groups who have come with intent to cause problems. There's an awful lot of people who don't, and that's the wonderful parts of Carnival, where we do get the good points of the music and the bands and the fantastic displays that we can see. But there are unfortunately other people who do turn up at events like Carnival with intent to cause problems and with intent to hurt other people. So we do recruitment at Carnival, but I take on board your point that we should always look to do more. It's something that we always look at.
Sorry. Yeah, sorry, go on. Were you going to ask me a question?
Yes, may I ask you a question, Seema?
Yes,
my name is Bo. I work for MVS.
Bo, I know you. We've crossed wires many a time. Hi.
Yes. Hi. Is there an upper age limit to the recruitment? So, given that many people at the moment might find themselves looking for a second career, as jobs are being people are being made redundant, do we have an upper age limit for the various different roles that you've described?
I'm so glad you asked that question, Bo. And yes, there is an upper age limit. And would you believe it? It's right up to 57. So the applicant can start applying at 17 and they could be hired from their day one as a PC constable at 18. But the applications that I'm going to be looking at and working with community organisations within the South West London area is right up until the upper marker of 57. And if I drill down to some of those BME figures, I'm most interested because I think one of our targets is to ensure that from the Black ethnic minority contingent that we are actually actively recruiting and attracting up to 40% Black ethnic minority women. And that's very exciting. I personally come from a mental health background and I've successfully transitioned into the Met Police, not as uniform. And you know, I think this is a really valid opportunity given this economic climate and for people who are perhaps thinking about career opportunities, transitioning from whatever circumstances they've faced this year into the Met Police. And I think that's a really good point that you raised. Thank you. And a really good carrot. So we're particularly interested in women who are Black ethnic minority and also who are career transitioning, like myself.
Can I ask a question? My name is Grace.
Sorry. We have people waiting before you, my dear. So let's take it in order. Jerry.
Can I just say one other thing? We have sort of volunteering opportunities as well. And again, I'd like to pick up some of those conversations or those points in perhaps much more in depth in another setting, because the forum here is far too large and I don't want to take up too much time.
Thank you. Okay, Mr.
Yeah, thanks, Marcy. Thanks very much to the two police officers, or what is it, or with your association.
I'm staff and I'm a consultant for the Met. Sorry.
That's right. I was saying with some association with the police.
That's okay.
Let me say right away that I've always had a very, very positive, feelings towards the Met Police, because over the years I've found them to be fantastic. Before you scream at me, I've found them to be fantastic in producing initiatives, along with the Catholic Church, actually, to help to promote good race relations. So, yeah. Now, one question, and it's to what extent, let me say first, I congratulate you on yet another initiative and, to help to improve the relationship between, especially young people, I wouldn't say just young Black people, young people generally, and the police. Although I'll say quite frankly and bluntly that the police have got to pick up jobs that should have been completed long ago within the home environment. Yeah. And let me say that right away. Now, my question is, to what extent will this new initiative, and that's new initiative in recruitment, help to smash gangs, and I mean it, and also improve the effectiveness against county line gangs?
I wish I had an answer to those questions. Unfortunately, gang activity and county lines are two huge problems for the organisation. One comment I would say is that an improvement in trust amongst community members from various different communities has to give us better information, which helps us to deal with and to target and prevent offenders. Better communications and better working between the police and the community has to improve things, has to take away the benefits of some of the benefits becoming a member of a gang or starting on county lines. Better recruitment has to improve trust, and that trust has to go towards us improving the way we can investigate various forms of crime. I'd love to say there's an easy solution to that. I'd love to say we're going to make headway into all of these problems. We always try. We work very hard in both targeting both gang members and people who've come out of gangs and helping them to leave the gang mentality. We have various groups of people who work in different ways to try and reduce and prevent county lines. We work with our county colleagues as well as various different organisations within safeguarding, children's services, with the council, with myriad organisations to try and prevent county lines and gang activity. There's always more we can do. There's always more solutions. I wish we could always do more.
Okay, can we have Councillor Bush?
Thank you, Bob and Seema. I actually have two questions. I'll pose the first one to Bob. It's in relation to the crime data that you provided on page 27, where we have the crime type of violence against the person, and it's gone up by 7%. So my question is, why has that gone up by 7% during a period of time where we've been in lockdown, so there's less person-to-person contact? And secondly, do we have a breakdown of that figure so we're able to see how much of that is represented by BAME? And then going on to my second question for Seema, I think the work that you're doing with recruitment of BAME into the Met Police is brilliant. However, I think we need systematic change from the top. So I want to find out what's being done to hire more senior people into senior roles in the police, because I think only then can we really have real change. Because as much as we want change from the bottom upwards, I think real change really comes from the top downwards.
Can I just come back to you on that? Is that okay?
Yep.
It depends on how you quantify change, actually. I mean, my remit, and I'll be very clear about this, is about recruitment from the bottom level up. We need to ensure that we are far more an inclusive organisation. And, you know, one strand to address that is on the recruitment side. And internally, I have to say that there are working groups that look at this very question about sort of this top level of, if you're talking about change in terms of recruitment and leadership, that's an ongoing transformative issue that is currently being looked at and has been looked at, I believe. But as newly appointed, you know, that's all in place. I hope that that's clear. Sorry if it's not.
I don't know whether potentially for the next meeting we could have an update on it at all. I appreciate you may not have the answer now. I don't know whether there's potentially an answer that can be produced or kind of given to us at some stage.
I can say that the MPS will be setting specific aims for recruitment and promotion of black officers. Exactly how that pans out under what form is unfortunately above my pay grade. That's something at a much higher level than my mere level. But I can say that there is a target being set. I don't know what that target is or how it's going to play out. Hang on, what was the first question? Sorry, That's
okay. It was in regards to the violence against the person. with the increase in numbers by 7% when we're currently in a lockdown, or we were in a lockdown, and how much of that, and what percentage of that, if you know, represents the BAME community?
First of all, I have absolutely no idea about the breakdown of the BAME community. I don't know how I would get that information. I'm not convinced I can. It's the version. I don't think we break it down to that level for ethnicity. I don't think I've got an easy solution to that without going into 4,000 crimes and sort of ticking off each individual case. What I can say is that although you've highlighted the violence against the person is up 7%, the violence where an injury has occurred is actually down 0.3%. So one of the things might be public disorder, so somebody being shouted at is up, but actual violence where an injury has been caused is actually down. An injury can be common assault, whereby you get touched. So that's effectively violence against the person without any kind of injury whatsoever. Some of the reasons for that includes concerns about domestic violence. There's been a slight increase in domestic violence due to lockdown, where more people are all cooped up in the home. That is something that we've been working very hard on. It's domestic violence. We're working on a domestic violence 2 weeks or 16 days of action that's currently ongoing. Throughout lockdown, we've been extremely concerned about supporting in domestic violence environments to make sure we can provide some support to people who often have more difficulty, can't get out of the house, and having more difficulty in getting the support that they need. So part of that increase in violence against the person has been down to domestic violence. Part of it has only been, as I say, has been an increase in reporting of offences, but that aren't actually involving any injury being caused, which, as I say, is down slightly.
Yeah, no, absolutely. I appreciate it may be difficult to kind of obtain that information in the breakdown, but I think if possible, it would be useful, especially for this forum where we kind of want to look at the data, and it'd be interesting to see what percentage of those numbers are made up of BAME individuals.
Okay.
But I don't know whether you could potentially look at it and maybe just kind of let us know, or drop me an email.
I can go and have a look at that and see if I can find anything, but I really don't want to make a promise I can't keep, and I don't think I can actually get that data.
Yeah, no, absolutely. Even if you just look into it, it'd be much appreciated.
Yeah, I don't want to give a false premise and say I can get that. I don't think I can, but I will certainly have a try at it.
Thank you, Bob.
Okay, Shiv? Shiv, ask your question.
Yes. I want to talk about the noise from the neighbors. We are dealing lot of cases at the moment, nearly 1.5 years, but we couldn't get any solution through council or through the police or through the Clarion House or anyone else. So what can we do for that?
Sorry, I've obviously not got a very good reception. Can you try and repeat that for me? I do apologise.
Yeah, we are receiving a lot of complaints about the noises from the neighbors. But
okay.
The people who are living in Clarion House, they have reported the police, reported the council, reported the Clarion House, but they didn't get any response till now.
Okay. Noise nuisance is a council matter for environmental health, but if there's long-term neighbours disputes and neighbours problems, the local dedicated ward officers are generally very good at what they do to try and sort out problems. Unfortunately, I'd love to say there's a solution to every single issue. Some stuff takes a long time. It also requires support from the members of the public and any other people who are involved in a block of flats who are willing to provide statements or provide information to us about further problems. So it may be that one neighbour is making allegations against the other neighbour is making allegations against them. It's very difficult for us to find easy solutions if we haven't got independent other assistance and other information coming in. What I would always say is that whatever the issues are, it should always be reported. And that way we can take it as part of a course of conduct, pass it to the Safer Neighbourhoods team, pass it to the Safer Neighbourhoods board within the council, the Safer Merton team, who generally do a very good job working with people like the housing and the noise nuisance team. So all I can say is keep reporting it. pass the information to the dedicated ward officers who are very good at what they do.
Thank you. Councillor Henry.
I want to say one more thing.
Go on.
Yeah, according to the issue, there's a family who is facing this problem in more than 1.5 years. We have tried all the things as a charity, but still they are facing the problems that now the family is depressed and taking tablets, and the children are very depressed. They couldn't go to the school, so we don't know what we can do, because we have worked with the social worker. We informed the council. They informed the police, and we informed the Clarion House. Nothing happened nearly 1.5 years.
Okay, as I can get in touch with the dedicated ward officers, speak to them again and say this is what the ongoing problem is, and see if they can provide any solutions. I'm not going to say they can definitely provide a solution, but they do know what they're talking about, and they can work very well with housing, with the council, and with any other organisation. But it may be that there aren't easy solutions to this, where there's cases in both directions where offences are being committed, or where there's noise nuisance in both directions. Unfortunately, I'd love to say there's a solution to every problem. There isn't.
Thank you very much. Thank you very much.
Okay.
This is only one case I mentioned as an example, but there are a lot of cases like this.
Get in touch with the Safer Neighbourhoods Board. The dedicated ward officers are very good at what they do.
Okay, thank you very much, sir.
Thank you very much. Councillor Henry.
Oh, thank you, Madam Chair. Okay, I have 3 questions. First of all, thank you both for your time coming here and also for your update. Right, my first question is for Bob. You talk about support. And so I just want to find out what support are offered to officers, especially BME, in their line of duty. The second one is, can you just explain the relationship between regulars and special at the moment? And because I noticed that of recent we have less specials out, and I just want to find out what's the reason why, and what the relationship is like between the regulars and specials. Also, when we do have police officers in certain communities, they have been there, they work very good within the community, they have a very good rapport, things are improving very good, and then they move to somewhere else. And that give us, more challenge, because the confidence that the community have, especially young people, in that officer have gone, someone new come in, and it's all change, and that become an upstir. So just want to find out, why these things are happening, and how can we change these things from happening?
We try and avoid moving people, but most of the time people will do a number of years, especially as dedicated ward officers, and often they'll then move on to get promoted or move on to a different challenge. If you look at the fact that we've got 68 staff across Merton Neighbourhoods Strand, if everybody does an average of 2 years, I lose somebody every 2 weeks. We lose a lot of people where they just are constantly rotating. While I'd love us to spend as much time as with residents who will spend 10 years at an address, if a police officer spends more than 3 or 4 years in a role, they'll often be looking, well, hang on a sec, can I do a different job? Is there something else I can do as a new challenge? So people are always looking to develop themselves, and we're obviously enthusiastic for people to develop themselves. So there's the perfect example that we're looking to improve recruitment and retention, but often part of that retention involves giving people a new challenge. We don't put somebody into a job in any other organisation and say, yeah, you know what, you've got to stay there for 10 years. We try and move people around to a certain extent so that they can continue to develop themselves. And then it may be that they come back to the certain roles and they can take their skills and experience on other positions. So while I'd love us to be able to spend more and more time and keep people for long periods of time, I think I've been in Merton for about 4 years now, 5 years, of which 3 have been in neighbourhoods. If you some of my officers have got sort of 10, 15 years within neighbourhoods. That's getting a bit past where they're particularly healthy in the same role. While we get benefits to keeping people in a role for more than a couple of years, we're always looking to develop people, and the proactive, hard-working go-getters that we want to have in the role are the ones who then go off and want to do something else. They want to get promoted, they want to specialise, become detectives, change their role and do more specialised tasks. And develop themselves. So there's always a balancing act between those two things. So I appreciate the requirements, and everybody says we want you to stay in post for years and years, because most of the residents will say, well, I've been living here for 15 years. I've had 5 different police officers. Well, if they're averaging 3 years a stint, that's actually quite good going. So there's an element of that side of things, but we do look to try and keep people in post. We don't move people around within the neighbourhoods as if I have a choice. I do try and keep people in their role for a decent length of time, but unfortunately, or fortunately, depending on your perspective, people are looking to improve themselves and go on and do something different. So I'd love to give you an answer that you want to hear, but unfortunately it comes down to I look to develop my staff, not just keep them in their role. Support to staff who are from BAME communities. As I said, the Southwest has got a support network and a specific support group through contacts, through there's one of the sergeants who's providing information to the senior management, so it's done in a controlled way, so they can say, look, I found this happening. It's a way of passing it directly up the chain of command. Ma'am Chappell is very enthusiastic and very keen for us to listen to people who've got any difficulties, and especially through the summer, through the BLM issues and difficulties that we've all faced. The support to our BAME colleagues has been extremely important. That comes from various different forms of support from their immediate supervisors, support from me to my fine team, to find out how they're getting on, find out if there's anything that we can do to support people, support within their own peer groups, support within from various different organisations. We have various different support systems, as was mentioned, female support groups, the Black Police Association, there's various other organisations. There's the General Federation that's all police officers in whatever the circumstances, with any difficulties and any issues. There were just so many different ways of supporting each other. But as I say, the most important point is support from people like me to my colleagues to say, okay, what else can we do? Is there anything that we can do to help you? And then looking after their welfare in certain environments. And that might include at times going, you know what, hang on a sec, I don't want you in this environment because you're getting a lot of abuse and I don't want you getting abuse. So it might be that I withdraw staff from certain areas if they feel that's suitable and they want to do that. If they are happy where they are, then I will look to support whatever they wish to do in an appropriate way. I think there was a middle question in there that I've missed. What was the middle question?
Between specials and regulars.
Oh, fantastic. Yes, I knew I'd missed something. I do apologise. Madam Chair, I must apologise for taking up so much of this meeting. Work with the specials. We work really hard with the specials. We really like working with the specials. Wimbledon Town Centre team do a lot of work with the specials. The specials work across the whole of the borough, are being developed, they are being worked, and we are working with them across the whole of Merton. I get on really well with them. I think we get on really well and we get a lot of benefit from them. I think we're actually in a really good position with the Merton specials. They seem to like working with us. We like working with them.
Okay, thank you very much. Thank you very much. Councillor Macaulay.
Thank you, Chair. I just wanted to reassure Councillor Omar Bush with regard to the question he put to Bob Whitehead in terms of violence against person. I mean, the rise of DV cases has been the hidden horrors of this pandemic. What is worse is that because the courts are short for the last 6 months, the perpetrators of these crimes have been, not been brought to justice. The reason being because the cases have not been listed for hearing over the last 6 months in most of the magistrates' court. And in the meantime, some of the victims have to leave their lives on hold, and so the numbers are rising on a daily basis. In the Southwest BCU, take for example in Wimbledon Magistrates Court, there's a special DV court on a Tuesday, which is listed for a whole day, but the court, I can tell you, the court is struggling, you know, to list case, because I was on a DV court yesterday, and obviously there must have been about nearly 12 or 14 cases listed for trial, but we couldn't even do 4 or 5. So they're 6 to 7 months behind. So you will find that violence against person is going to continue to rise until such time as the courts are able to deal with these cases. So I don't know if that's a bit of a help to you, Councillor Bush. Thank you.
Okay, Councillor Edith. I have one question about stop and search. For Bob, what is your take on stop and search? Because they don't seem to be an ease up on stop and search for Black people especially. So
okay. There's a number of issues to do with stop and search. We can always do better. Let's start with that as a statement. However, one of the things I would always say is that when people say, I'm unhappy with the fact that the police did this, that, and the other, not a problem. Get in touch with the stop and search panel. Okay, we have an excellent stop and search panel who will hold us to account. So if you hear anybody saying, I was stopped by the police and they did a really bad job, and this was the circumstances of it, tell people, get in touch with the stop and search panel. The stop and search panel views the body worn video, they would circumstances of any stop and search and say, okay, not a problem. The stop and search panel will then look at that exact specific stop and look at the circumstances of it, look at the grounds of it and say, you know what, is that acceptable for the police? So we have a system in place of that. But the most important point is if somebody's unhappy with the stop and search, tell them, complain about it in an appropriate way. Raise it to the stop and search panel. We frequently hear people saying, oh, the police did nasty stop and searches, this, that, and the other. And then we actually watch the body worn video, and it may not be completely the same circumstances that people are realizing. And it may be that we've received specific information that says this person is carrying a knife. And it may be that, an example, if there's 5 people who are carrying, and we get information that says one of them is carrying a knife, then obviously we're looking to concern and make everybody in a safe place. So one of the things we might do is we might treat people quite aggressively because we're trying to gain control and make sure that nobody gets hurt. Now, I appreciate it means we need to spend more time explaining the circumstances afterwards and saying these are the reasons why we've done what we've done. And I appreciate we should always do more to explain what the nature of the circumstances are. But often we need to try and take control to prevent somebody with a knife from getting injured. The issue for me is that, yes, I appreciate stop and search does have disproportionate impact on various different groups. However, knife crime has a far greater disproportionate impact on various groups. So the question should be, surely, what are we doing to prevent knife crime? What else can we do to prevent knife crime? Stop and search, unfortunately, is one tool that I do appreciate does have an impact on different groups. But if you look at knife crime across London, you are 8 times more likely to be the victim of violent crime if you are Black than if you are white. So we stop twice the number of people who are Black, depending on different age groups and various different groups. And I appreciate we need to do, I'm not saying we shouldn't, but the most important point is we are trying to prevent knife crime. We are trying to prevent people being injured and stabbed. And I don't want to see anybody being stabbed on the streets. And unfortunately, knife crime does have disproportionate effect on certain groups. So unfortunately, stop and search, if you look at the number of people who are out in an area, does have disproportionate effects. One of the other things I would point out is that if you look at, say, the diversity of Merton as a borough, the older population, if you're over 60, you're far more likely to be white in Merton. If, however, you're under 25, the percentages are vastly different. We're also working on data that is from 2011, so it's 9 years out of date. Now, I can definitely say that the diversity of Merton has massively improved and increased over the last 9 years. But we're still working on data that is 9 years old for our comparisons and for the way we look at certain things. If you look at the young people who are in the immediate area and the ones who are being the victims of crime and the ones who are committing any kind of crimes, we should be targeting those offenders who are more likely to be committing crimes. And we want to prevent knife crime. That is the most important point, is preventing knife crime. Sorry, Logie, I can't quite read what you're saying. Other than I agree. So yes, I appreciate we should do more. But the most important point for me is if somebody's unhappy with the way they were stopped and searched, raise it with the independent stop and search panel and get them to, they often look at the body worn video and they hold us to account. If people aren't happy with that, great, hold us to account, give the circumstances. Don't just tell people, oh, I was the victim of a nasty stop and search. That's fine. Tell us the details about it. Tell the stop and search panel about it, and the stop and search panel will hold us to account. And if there's people who are doing things wrong, we need to know about it so that we can improve.
Okay, thank you very much. Well, I think we spent enough time on that topic, so we'll happily close on that.
Is it possible for me to just ask a quick question? Is that all right?
Okay, go on.
Yeah,
just a quick one, sorry.
I have been waiting for some time.
Oh, I'm so sorry, because I raised my hand. I didn't see another person's hand. It's okay.
Go
ahead,
on.
please.
Right. Thank you for your presentation, Bob and Seema. My question is, have you got any data that reflects either hate crime, and what is the level of mental health situations that you come across within your portfolio and role across the borough?
Hate crime is provided to the IAG. I don't have that data on me right now, but if you are interested in joining the Instant Action Group, they look at all forms of hate crime and they look at all the figures and the changes to hate crime figures across Merton. So that comes up a separate committee. That's the IAG. Father David Pennells is the chair of the IAG. Yeah. You can get in touch with him. I'm sure Everett will provide his details to you. Join the IAG. We're always looking out for more members. That's where that is looked at.
Sorry, Bob, if you have that data, could you share it with me and then I'll share it with the JCC, please?
I dragged that data off of the computers for the IAG meeting, so I don't have that data available.
Yeah, but I think it's useful information for us to be able to see.
Join the IAG.
It does offer a profile.
And then you can get it directly from that.
Right.
Okay. Thank you. The young lady.
Could I, sorry, I just wanted to quickly just interject in regards to what Bob said in regards to the stop and search panel.
Sorry, Councillor Bush, we have a young lady who has been waiting for a while, so...
Sorry. My only thing was, I just wanted to just quickly say, with the stop and search panel, I'm 28 and I've never heard of this stop and search panel. So if this stop and search panel does exist, I would strongly recommend that it's advertised amongst that age range that are being stopped and searched, because I'd never heard of it before until tonight. And it'd be interesting to see whether it is being advertised to schools, sixth forms and colleges, so that they are aware that if they are being stopped and searched incorrectly, that they can go to a certain body and to have this investigated. So as good as this body is, if no one knows about it, it's pointless.
Okay. One of the people who was the chair was involved, or a lot of the people are involved in youth services and youth organisations who are on the panel, but I appreciate we can do more to publicise that detail.
Okay. Finally, the young lady, I don't know her name.
All right. Hi, I'm Sharon. Yeah. Hello. Sharon, yes, just a quick question with regards to community engagement with the police. I'm not sure. How would you describe the relationship the police has with particularly those between, say, the 25 and younger, and if there are any data showing some sort of improvement over the years, and what's your plan in terms of improving the relationship with the community? Because I believe firmly in prevention, as opposed to we talk about stop and search, we talk about so many interventions, but I'm kind of thinking that there's more that can be done to form that relationship and have they come to you, have them see you as support and advocates, as opposed to seeing you as the baddies, so to speak. So just please, can you shed some light on your relationship with those in the community and any data to support that?
Okay, I don't have data to support that right now. What I can say is that we have a schools team. Schools officers get involved in all of our senior schools. They speak to them and explain to them circumstances, how they can work with us, what they can do. They get involved with the young groups. My PCs and PCSOs will always get involved in any youth group they're allowed to. But unfortunately, we have some issues with certain youth groups saying, you know what, we don't want the police turning up. But that's not to say we're not here available, and we're trying to get in touch with people. We've got the youth groups involved. We are always looking to improve that. I'm always looking for ways of improving our community engagement, especially with young people. But as I say, the schools team are the predominant people who are working in that direction.
Okay.
I just had one quick question that I've had my hand up for a long time. I haven't been able, no one's asked me anything. It's a very quick one.
Go on.
Yeah, just to thank you, Bob, for being so supportive to us, asking you so many questions. Just a simple one. Have we got the percentages of retention of BAME officers and the breakdown of that BAME nucleus that's being retained? What the retention of them are?
Retention, no. I can tell you that right now, hang on, I did bring it up. I think I said 15, hang on. It's longer term. I don't think we've got that immediately available. I can say that right now, in the November 4th data, it said that 15.3% of PCs of police officers are BAME and 18.5% of all staff. So although we do have a list of the total number of staff, I don't think we can say what the level of retention is off the top of my head.
Thank you.
Okay, thank you very much, Officer Bob and your colleague. Thank you very much for coming. And if you have any questions, you can share it with Everett and she will find out further for you.
Just to say, Councillor, that I've actually left my contact details in the chat, and I'll reiterate again the conversion of volunteers to PC constables. I'd like to work closely with your community groups and discuss that strand of recruitment in greater depth, and how we can really strategise on bolstering our communities to ensure that they have a fair chance at the recruitment process. Thank you.
Thank you for taking part. Thank you. Okay, so you can look at the chat and then get her details if you have any other questions, or if you know of anyone who wants to volunteer or be a part of the police force.
Oh, councillors, I think Councillor Bush and yourself, I can pass on my details to yourselves and we can cascade that or have a follow-up discussion if that's appropriate, and you can do
Okay, thank you very much. We'll move to item 6, update of the COVID-19 community resilience research by Hannah Neal.
Hello, everyone. It's interesting about the police because we've just had a publication which we've just put out and about COVID, and in it we've got building trust with the police, and we've added quite a bit of information there about people who want to actually join the Met. So ahead of you, we have been publicizing your work for you. Now, thank you very much for having us here this evening. I have with me Raghavi Rajan. Raghavi, I haven't seen you on screen, but are you there?
Yeah, I'm here, Hannah.
Good, okay. Raghavi is with us. She's been working on this program with us, and she's conducted a number of the interviews we've done, and she'll be carrying out some of the analysis of the first part of our findings in this program. Like everyone else, we were taken aback by the alarming reports of the numbers of deaths and hospital admissions among the AME health workers and other personnel. And our immediate reaction was to find out what on earth was going on and how we could help. But more immediate was finding out what plans Merton Council had to intervene in this crisis. Now, we got in touch with the relevant officers at the council, and immediate steps were taken to put together a task force which would look into the various issues and take action. This was immediate. It was quite amazing the swiftness with which a task force was put together and action was taken. Now, there's been quite a mushrooming, as you know, of groups working locally and elsewhere on the various aspects of this pandemic. But the Council recognized a pressing need for additional work to be carried out locally with BAME communities could be most affected by the virus. So one of the action was that BAME Voice was commissioned to design and deliver a body of work which looked at people's real experiences of the virus and other health issues among these communities. And we were looking at communities such as the Bangladesh community, the Pakistani community, East, West, Southern African, the Caribbean community, the Tamils and other communities such as the Filipino, the Chinese and the Indian community living in wards which had been, which are the fastest growing wards in the borough. And this, of course, as you know, is in East Merton. Now, we were working through these communities. Obviously, we can't do all of them at once. So we started with the Bangladeshi, the Pakistani, the Tamil communities. And in the second round of our work, we're going to be doing more work with the Caribbean communities and the African communities. Now, looking at the aims and objectives, and I think you've got them there in your pack, I've already talked about the designing and delivering of this community resilient program, but from the beginning, we were quite sure that the way to approach this work was to make it a bottom-up investigation, that those most affected were telling us, not us telling them, what was important, what was relevant in determining the impact the coronavirus was having on their lives. Now, this was, after all, their living reality. This is what people were living day by day. It was their reality. So it was up to them to tell us how this impacted on them. We were also quite sure that we wanted our work to be carried out by BAME personnel, and that the end result was recognized as a BAME product. So often in the past, the valuable work carried out by BAME communities and organizations have been subsumed into this big melting pot with very little, sometimes no recognition at all, given by name at least, to these organizations who could play such a vital role in determining that information that made up that particular report. So going now on to the aims and the objectives, we see that there was a plethora of ideas for the program, and looking at the aims and objectives, number 2 was to understand the impact that COVID-19 has had and to build resilience in its different forms, reducing the risk of these communities in terms of infection and health outcomes. We were to go out there to make sure that people were aware of how to stay away from getting the information and also some of their other health outcomes which would result from this virus infection. And under number 3, identify any stigma or structural barriers experienced by the communities and help identify practical policy responses or local action to address specific concerns. And lots of people express their specific concerns, and we are to take these back, and we will be taking back. And in our interim report, we have taken back some of those concerns, and we're looking at how the council and the various agencies can step in to help bring these about. Now, also, number 4, help support building of trust, signposting to appropriate support programs, and to identify community leaders who could have a wider role in the approach. Now, one of the issues has been that the BAME communities are hard to reach. Thank goodness we no longer use that phrase. I hope we've completely wiped it out, because the BAME communities are not hard to reach. It's the methods that are being used to contact them that have been hard to get to them. So that we found in number 4 there in providing, number 5, in providing training and support for BAME workers to tackle workplace bullying, racism, and discrimination. We found out that there was a lot of hurt within the BAME workforce, even within the council. And one of the workshops that we carried out on resilience brought out this very, very vividly, that people did feel bullied, people did feel that they were discriminated against. And we're very glad to see that the BAM forum, which had lapsed over a number of years within the council, has started up again, and the issues were being discussed. Now, there's also a number 6, working with partners across Merton to increase engagement with vulnerable and higher risk communities on key COVID-19 related issues, such as the test and trace as a self-isolation, and various other organizations like the Community Hub, where people could be referred to. And now there's a lot more information for the test and trace, which we didn't have before. So in carrying out these objectives, we have discovered not what we were told would happen, that we would find people who were weak, who were not connecting with the communities. But we discovered a lot of very strong, determined residents, some who were very angry at being the focal point once again for negative publicity. Why us again, they asked. Why are we being stigmatized again as carriers of a disease? Because those glaring headlines, BAME communities, are rifled with this disease, was very upsetting to a lot of people. But many of those we talked to were strong, determined people who wanted to cooperate and wanted to work with the system to make sure that the disease didn't spread, not only amongst the BAME communities, but also among the wider communities. So most of the voices that we talked to, the people we talked to, were voices that had never, ever been heard before. These are people who had never been approached, but even if they had been approached, didn't volunteer any information because they were so angry and they felt that they had been ignored, only spoken to at various times when their help was needed. So our aim is to seek out more such voices, voices that are going to challenge us, as a BAME community, but also voices that are going to challenge Merton Council to continue to look into the issues which are confronting the BAME communities. So I'll hand over now to Raghavi to tell you a bit about the progress that we've made so far.
Hello everyone, my name is Raghavi and I've been involved with this program since it began in August. So we started the program in August with the training of young interviewers. So this session took about 3 hours where we trained about 23 different interviewers. And up to October, this is our progress so far. So throughout the last few months, we have spoken to and collated information from people in various forms. So some came into our offices, some by phone, and others were our family. We interviewed 30 individuals by phone and face-to-face. We had 9 interviews online conducted by Patrick. 23 people attended our face-to-face workshop. This workshop had 2 different sessions and this happened before lockdown. 40 participants attended our virtual resilience workshop. These participants were workers from the Merton Council who were managing frontline staff and were working in the social services sector within the council. 60 individuals were from pod groups. So these interviews were held in groups of 10 where they were asked questions and they had to answer them, and they were also able to ask questions themselves. We also got in touch with 22 people by email. So in total, we got in touch with 184 local residents. So in total, we talked to 56 men from the ages of 9 till 65. The ethnicities of these men were 65% Asian, 30% Afro-Caribbean, and 5% were other ethnicities. We talked to a total of 128 women from the ages of 11 till 55. The ethnicities of these women were 60% Asian, 60% Asian, 39% Afro-Caribbean, and 1% were other ethnicities. 20% of those we interviewed were in education, 30% were in employment, 25% were in business. Now, these included people who suffered the most, such as taxi and cab drivers. 15% were unemployment, although this rate did increase throughout the program, and 10% were retired. The wards we covered were Figs Marsh, Cricket Green, Graveney, Abbey, Colliers Wood, Lavender, Morden, and Pollard's Hill. And 2 outdoor promotion events were taking place, one in Mitcham Town Centre and the other one in Lavender Ward. And we also had 3 resilience workshops that had taken place. Thank you, Hannah. So I'll just pass it back to you.
Right, thank you. Thanks, Raghavi. Raghavi is one of about 10 young people that we've recruited to take part in this program. And their range of age is from, as we said, from 9 years old to 35. And one of the interesting points that has come out of this is that in homes where English isn't a first language, young people have been able to explain most of the issues to their older relatives, because they would normally not be at home, but the lockdown has made people come closer together, so that the young people now are being used as a catalyst for explaining some of the many health issues that are involved with this virus. Now, people ask us, we've been talking about this for many, many years. We know what the issues are. Nothing has changed. So we have here some of the changes that we want to see as BAME communities. And this is what people have said to us. This is not something we've plucked out of the air. It's something that is concerning a lot of people. And the main one is that people would like to see BAME people at decision-making tables where the decision is being made. There are very, very few BAME personnel there. And BAME Voice has, over the past 2 or 3 years, managed to get a good number of people onto some of those forums and some of those boards. So we are being represented quite a bit on those decision boards. There's a lot more work that needs to be done, obviously. And there's also accelerating something that's been spoken about over and over again, ethnic minority people into more senior leadership roles on merit. And it was very good to hear that it wasn't because people didn't have the qualifications, it was just the opportunities that were not there, and that something new had to be done to make sure that people were put into those leadership roles. The resilience and recovery through BAME communities helping themselves. I think we need to be very honest that sometimes we talk about what other people can do and very little is said about what we ourselves can do. As a community, we have a lot of work to do amongst ourselves. And this is what we're hoping to do with this program, to talk to BAME people, to see how we ourselves as communities can help and work with the status quo to be able to bring about the equality that we so desperately need. And also strengthening of social capital, this view that people, that we view people from a position of strength, that we don't always say BAME people are deprived or BAME people are poor. This annoys quite a lot of people, but that we look at the strengths that are within our communities and use those strengths to help build up a wider community and to build up the borough. Then also we looked at this review of the doctor-patient relationship, that there was a serious problem between patients who don't have English as a first language and the doctors, so that there's a repeating visits to the doctors and nothing really comes out of it, so that all these illnesses that we hear about, something could be done about it if only there was a better understanding between the patient and the doctors. And then also we looked at providing more community medical facilities. And I think we must give credit to the NHS and to the CCG for the work that they're doing in opening up the community, opening more health facilities within the communities so that people have a choice. But we felt that many more could be opened within the communities. So that's really some of the changes that we'd like to see. We've got quite a lot more we'd like to say, but I think we spent quite a lot of time on this. But I hope there are questions which will come forward. But I'd like to thank so many people who are there on your paper. But I'd like to thank two people in particular who no longer hold the positions they held at the time of our commissioning. There's a former leader of the council, Councillor Alan Brittis, and former cabinet member of the voluntary sector and former chair of JCC, Councillor Edith Macaulay. With John Diamond, Everett Willis and Barry Koza, they and all the other names listed have supported this program, and we will do our very best, not for asking for preferential treatment, but for an equality of opportunity and a sense of belonging. Thank you.
Okay, thank you, Hannah. Are there any questions? Councillor Henry?
Thank you very much.
Henry.
Thank you, thank you, thank you. And I'd like to say thank you both, Reverend Anna Neil and our colleague.
Raghavi.
Right, Reverend. I have to give you a status. Yes, you know, I have been a councillor for, this is my second term. And I want to say it's the first I've ever heard Reverend Neil really speak up so strongly. And, you know, because I always going out there trying to, you know, get people to get involved in the BME meetings, just to listen and hear what we have to say and what contribution, you know, we can make. And I would just like to say to all councillors, it's very important. We have a community with many BME people in our community. We need to start speak to them, tell them about getting involved, tell them about, you know, what we are doing. And I mean, coming to these meetings, open up a lot of cans of worms. And also we can start to do something differently. And this tonight meeting, I think, you know, we have 31 people here, and I hope our next meeting, it will be more than 31, but not only people coming to, you know, take part and listening, but, you know, share your ideas in the community and use it effectively. So no matter what you do, you could be a gardener, you could be a painter, you could be something. We all have a skill. We all can share our ideas and work together. I mean, words are important, but if you don't hack on the words, you're doing nothing. Thank you.
Okay, thank you, Councillor Henry. Obuka, is that the correct pronunciation?
It's absolutely fine. Most people call me Kaz. Reverend Neil and Raghavi, thank you so much for your presentation.
Can you speak up a bit? I can barely hear you.
Certainly. Is this better?
Yeah.
I just wanted to thank Reverend Neil and Raghavi for their presentation. So I was in conversation with Barry as we were formulating our response and hearing and seeing some of the earliest evidence at the height of the pandemic. And I was really excited about this work, because my sense was that there's a lot that I and my team, so I'm head of patient and public involvement and equalities in Merton and Wandsworth for South West London CCG. So you received a presentation from my colleague Aman earlier this evening. And I thought that for our team, there would be a lot for us to learn and for us to be able to bring back into the NHS from the kinds of work and practice that Reverend Neil and Raghavi have been carrying out since August. The question I had was what your thoughts were on some of those lessons. How might we, one, keep the people who have been involved in gathering all of this evidence engaged and and able to influence what we do as an NHS and maybe other parts of the local health and care system, even other public services locally. And then also, were you hearing anything, you know, even though it's still at a preliminary stage, that we'd want to take back to colleagues within the NHS? And I guess finally, you know, is there anything that people said that they might need from us as an NHS in order to continue to work as, you know, connectors, leaders, and already do great things that they're doing as resilient communities, as strong individuals within their communities?
At the moment, what we've done is we've prepared an interim report, and Barry has details of that. And in that report, we've made some recommendations. And I think one or two of them have already been implemented. For example, one of the recommendations we made was that people were complaining that they weren't getting your messages. Your messages somehow were not getting through to the community, to people who perhaps were not on Zoom. And there are many, many, as you know, within our communities. This is probably one of our problems, is that, you know, we're a speaking community, we're a social community where we get together, and this virus has taken that away. And there are lots of people who are not on Zoom or on Teams. So we have to find ways of getting across. And I think I pointed out this publication just now about the police. This publication is also about COVID-19, and there's lots of your information we've put in there. But this interim report, and as I was saying, one of the issues we brought up was going out, use a megaphone. I know it sounds ridiculous, and for some people it might seem amusing, but just go into those public places that people are and just use a megaphone or use a microphone and, you know, put your messages across, because that's the only way now. If you're not on Zoom or on Teams, that's the only way now that you're going to get your messages across. And I think this has started happening, and that there have been kiosks and places where people have been meeting at you know, places like where supermarkets are, you know. So that's one idea. And I think I did say that CCG and NHS have been doing an amazing job, you know, in terms of putting those messages across. They've come across to people who have English as a first language and who have access to the virtual media. But what about, we're talking about people who don't. And those are the people that we are going out to talk about. And we will be presenting all our findings to you.
Okay, thank you very much, Maddie. Any other questions?
Yes, please. Yes.
Okay.
It's not a question. I just want to say, Hannah, thank you very much, because you seem to have got the, you know, what people were really upset about, were wanting to talk about, and when you get the report out, we'll have to encourage those people and other people to actually really read it and see that something is actually being done, so they can be reassured, because people especially when the COVID came and they mentioned the BAME, people were so upset that people were trying to sort of stigmatize us with that illness. So thank you for, it's reassuring for people to know that something's been done and their messages are being taken, their worries are being taken aboard. Yeah.
Okay, anyone else?
Councillor, I think it's Sharon next and then Grace.
Sharon, yeah, Sharon. Go on, Sharon.
She's on mute.
No, I'm very sorry. My hand was up from before, so I just lowered it. I'm sorry about that.
It's all right, it's all right.
Okay.
Go on, ask your question.
No.
Does Grace have a question? Her hand was up.
Hi, thank you so much. Hannah, that was brilliant. Thank you so much. It's a pleasure to meet you in person. So my question is around the story of this idea that the BAME community are disproportionately affected. We know that in the very beginning when COVID first kicked off, the narrative at that time was it was harder for Black people to catch COVID.
Yeah.
I attended one of the JCC meetings a few months ago for the first time. And one of the statistics on there, one of the figures showed that 13% within Merton, I calculated at that meeting, of the BAME community had COVID. Could you shed some light? Has this figure changed? And if it is still 13%, what percentage within Merton are considered BAME? And I do, as you know, Hannah, I'm not very keen on the BAME terminology, why everybody's dumped in this one pot if they're not white. But it's really, I feel it's really important to break that down so that we can analyze and understand which communities are more heavily impacted and how we can go about helping those communities specifically.
I think that is the $50 question, because at the beginning of this meeting, I think that was brought up, but there's no evidence, there's nothing, no figures. Perhaps a gentleman from CCG might come in here, but we have no figures at all to know what percentage of those people who died were from the BAME community. Barry has not been able to provide this. I don't know whether the gentleman from the CCG can help us on that. We've asked, but it's been said that there's nothing that's been determined yet.
Sorry, if I could just come in. Public Health Merton are working on the statistics, and Barry's sorry that he wasn't able to share it at this meeting, but as soon as it is available, that breakdown will come to me and I will share it with the JCC.
Thank you.
Can I just say, it's very important just to minute that this is a question we've been asking since March. We're now in December, and the council still doesn't have that information.
Okay,
to hand.
I will minute it, but to be fair, the data that Merton has comes from Public Health England. One of the difficulties was at the beginning of the pandemic, the data wasn't being collected. There's lots of different data sets and it wasn't so straightforward. I think Public Health England, all the agencies have learned over a period of time. And certainly locally, we are committed to getting that data, breaking it down and really understanding. So that information will be shared, but it's our local public health team that's using the various data sets, because for some reason it's not in some sort of straightforward format nationally and locally, but we are working on that. And in terms of the BAME population in the borough, it's 37% at the moment. In the future, it's projected at 40%, but currently it's 37%.
For the younger people, it's much higher. It's going as much as 44% for the young people. But also, I think one of the problems of not having this figure was that the ethnicity wasn't mentioned on the death certificates, so that people didn't know, who the people were, where they came from. at death. But I think that has now been corrected, and ethnicity is now being put on the death certificates.
So then the question then comes into play, the disproportionality is not across every region and every borough. So where is that disproportionality lying? Because then I would argue that every death is a terrible death, but if it's true that we are 13% of the overall figures, when we have a population of almost, let's say, 40%, that's not a disproportionate. And so therefore, you know, I think this is something that probably in your excellent report, it's something that should really be highlighted. What are we looking at? Before we start writing a report, we need to know the data.
I think you'll see that the narrative has changed, Grace. The narrative has changed considerably from those early figures that were given to us and that disproportionate ratio that was given to us. The narrative has now changed. And for example, now you find that at the start, it was mainly the Asian population, but now you see it shifting towards the African and the Caribbean. So it's changing all the time. It's fluid.
Thank you.
Okay, anyone else?
Somebody's there. Who is it?
As Fitzroy has a question.
Okay, Fitzroy, go on.
My question basically is that I wanted to see how, well, first of all, I'd like to say thanks to Hannah and a colleague in the presentation and in-depth information. I noticed that the numbers of 184 was broken down, and I wanted to understand how that reflected within the BAME population of Merton, just so we can see a percentage once it's completed of how many BAME individuals were actually responding to this particular program that's being led here. The other thing is basically that I find that sometimes how we could support the work that's being done. I believe that there could be more support given by BAME organizations. So in other words, I support the volunteers that you have that are going and doing the work they're doing, and congratulations to anybody that volunteers. My hands up to them. But I do feel as well that you're missing a trick in this element, and I think the organization should contact and offer support and to seek whatever training required to maybe gather from their membership the questions and data that could add to the report you're doing, so you capture a far greater depth of BAME community within the borough of Merton. And as one that's always a champion for the Caribbean community, I do feel that with our Western Family and Friends Association, we're quite happy to gather data and to pass it on. And I'm sure that the chair, who's also the chair of EMC, which is identified as an organization that's in the first tranche of support, would be willing to drive, you know what I mean, this, and because I think it really benefit the Caribbean community, and the Caribbean community don't want to feel that they're left out in any way, because I know the percentage there, but it's a very small nucleus, I think, at the present moment that has been captured, and we'd hope to be able to assist, because the greater the nucleus the data is gathered from, but I think that the better the results can be, and the better the support can be given. And just to try and get a clarity, I've always asked this question of the breakdown of the BAME in Merton. I know the BAME areas are being focusing on, and I know Slavic isn't here, and I know sometimes the Polish community think that they're in and then they're out. But for me, I really support what's been done and would like to contribute as much as I can to the good work that's already been presented. Thank you.
Thank you. Thank you, Roy. All noted. Thanks.
Thank you very much, Fitzroy. Any other questions?
Yes, Abba here. Yes,
okay.
Yes, I've heard what Roy has just said, which is quite true. But on the other hand, when you think about the breakdown of MNB community, I think the council should have it, because I believe, Everett, you should have that for us of the breakdown of the BME community, because we cannot arrive at 40, 37, whatever percentage, and we are not able to break it down in terms of the different communities that are in the BM. So I don't know if Everett can furnish that.
Yes, we do have that data, Abaya. That data is available, and what I can do is share it. We have that data from the GLA projections, census data, all sorts of different data sets, but I'll share what we have.
Okay, thank you.
Okay. Anyone else, or we'll have to go to the next item? I want to thank Hannah. What's this girl's name?
Rajavi.
Ragajiva? What's her name, Hannah?
Ragavi.
Ragavi. And also, Hannah, you missed out Councillor Ottawa, who was the cabinet member for equalities, women and equalities.
The names are at the back?
Yeah, so I just want to mention Councillor Ottawa.
Yes, absolutely.
Okay?
Yes.
Thank you for your contribution. So thank you very much, Hannah, again, and looking forward to working with you and all the good work you've been doing.
Yeah.
So we will now move to the other item, item 7, employment update. So we'll invite Liz Hammond to come and give us her take on.
So good evening, everyone, and thank you for inviting me along. Now, normally this report just focuses on senior recruitment, because that's what we've been asked for in the past. Since the last meeting, there has been very little movement in the way of senior recruitment, and I felt that the report, if I just focused on that, wouldn't really have a lot to say. What I can say, since the report was written, is that we have completed now a senior appointment for the AD of Public Protection Post. That recruitment, we chose the headhunter specifically for their expertise and track record in bringing successful BAME candidates to senior appointments. The long list had 30% of BAME candidates. The short list had 30% of BAME candidates, and the final panel interviews had 50% of BAME candidates. But the successful person that was appointed into the post was white. So we did go through a really rigorous process, but the best candidate on the day was a white candidate, and that appointment has been made. We're also just starting the recruitment for the Director of Children's Schools and Families, as Rachel actually has left us today. And Hannah is taking over looking after that area of the business in the interim. So again, the appointments panel met the other evening to look at the process, to agree the headhunter that we would use, again looking at their specialism in terms of successful appointments, not only in London, across the country, and in particular bringing successful candidates to being appointees. So that's kind of where we are with senior recruitment. So I thought I would take the opportunity of focusing the report on a much wider, and actually sort of feed back to you where we are as a council, right across every spectrum of initiative that we are taking in terms of equality and diversity. I won't repeat the report, but the appendix that is attached to the report is a preview of the equalities and diversity in employment report that we have now committed to producing every April. That report will actually focus strands of diversity when we produce it for the first time in April. It will be a public document both internally and externally. But we want to, because of the issues surrounding BAME and the priority around those, we decided to pull the data at September and look at it purely from a BAME perspective. So there's a number of things that the organisation are doing, not only in terms of trying to improve our recruitment process right across the board, not just from a senior perspective, but many initiatives working with our BAME staff forum colleagues in ensuring that Merton really looks internally at itself from a racism perspective and is able to satisfy itself that any perceived or actual racism is wiped out and is not tolerated and does not exist within the council. I'll open it over to any questions that you might have on the report or the appendices.
Hello, Debbie Allen. Can I ask the ethnicity of the panel carrying out the interviews?
So yeah, so there was 3 people on the panel. There was a white male, there was a white female, and there was a BAME female.
Okay, are they all at the same level, or?
1 director and 2 assistant directors.
Okay, and they've all had diversity, well, it's in the chat here. Have they all had unconscious bias training?
I'm afraid I can't actually confirm whether they have. I mean, we have rolled out unconscious bias training. I couldn't actually give you that for certain tonight, whether they have actually done it, but they would have certainly done the recruitment and selection training, which obviously looks at the bias that is potentially present in recruitment.
Will that data be available at the next meeting?
I can certainly find that out for you, yes.
Lovely, thank you so much.
And just, can I jump in there just to delve in deeper on that one? So you said one white male, one white female, and then you said BAME. And can I just ask what do you mean by BAME? Is it a Black, Asian, Polish, or other BAME? This is why I struggle with BAME, because I'd never know where that's from.
Yeah, so I would say Black.
You would say, or you think, or you know?
Well, as far as I could tell, without actually looking at their ethnicity, I would say they were Black.
Okay, can we get clarity on that for the next meeting? So 2/3 were non-Black. Okay.
Councillor Omar Bush, if I could ask a question as well, Liz, if that's okay. Thank you very much for your reports. Looking at the detailed data analysis, there seems to be a systematic failing for BAME staff. And I think as a few people have kind of indicated on this chat, it'd be good to kind of see the breakdown within BAME, so that when we're able to kind of establish how many Blacks are there, how many Asians, what other kind of minorities, and what others are we kind of looking at? Because if we look at the data just kind of from what's been presented, out of the 34.4% at the 30th September 20, those 34.4% were BAME staff. However, only 13.9% of them were 5% of the top earners within Merton Council, with then a further, then kind of looking further down at the current workforce salary band, that there is no BAME employees in excess of £80,000. They were all white. There was no BAME employees at all. And then kind of when you divulge and you go into the numbers a bit deeper, there seems to be a ceiling within Merton Council, whereby we have a lot of ethnic candidates, but they may be struggling to progress within the council and move up to those more senior positions where decisions are actually being made. And it kind of goes back to my original comment that I made earlier on this call, that it's vital for us to have BAME candidates and BAME employees at every level, but we need to make sure that they're also at senior levels, and not just on your less than £19,000 per annum, where 70% of BAME employees are currently sitting within the council. So I think there is a systematic failure that we do kind of need to address, and whether that's via unconscious bias training or making sure that we have greater representation and potentially for the next meeting, whether we could potentially divulge into these numbers a bit further and actually identify what percentage are Black, what percentage are brown, what percentage are those other ethnic minorities that fall within BAME.
Well, a quick one. For some of us who've been long with the GCC, the question Omar is trying to ask has been asked for quite a very, very, very long time, and we've never got any answer to it. There have been so many recommendations about employment structure within the council, and nothing has been heard. So I'll be surprised really if they will come across with anything for now, because as I say, Omar, you're asking a vital question, but as far as I'm concerned, those who've been with JCC for over 10, 15 years can verify that to say, this question has been going on, and we've never desperately all the recommendations.
Yeah, absolutely, it's a failing from the council. We need to see how we can fix this, because as we've kind of all established in this meeting that we've been part of for the past 2 hours or so, that there needs to be some sort of change rather than us sat here just kind of putting recommendations forward. And I think it's all vital for us to kind of work together. But yeah, absolutely, if we can have some sort of change, and hopefully those numbers that you're able to kind of look into, we can move in the right direction.
So if I could respond to that, I was not aware that this was being asked for, and I do have the breakdown of our BAME workforce, so I can provide that. The only caveat I would say is where we get down to figures that are below 10, we can't report on what is less than 10, but we can certainly give you the figures that are above 10.
Yeah, no, the breakdown would be brilliant. It'd be good to kind of see what those numbers are made up of.
Liz, may I ask a question? It's Councillor Bailey.
Yes.
And having a look at your report, which thank you so much for providing such detail, and I'm looking forward to hearing or seeing more detail as well. Kind of similar to what Councillor Bush was saying. It's in your report. We've got the on page 54.2.9. It does show that there seems to be we're less able to retain staff that are not white. Do you know if there's any? Can you give us an update on what actions are being taken to, first of all, understand why that is, and second of all, like improve it? Because I remember like in the last 2 meetings ago we had with Rachel, she mentioned that perhaps, not Rachel, Hannah, sorry, I can't remember her name. She one of the former director mentioned that it seemed to be an issue with us not being able to keep people. So I wondered if there was any further movement on that.
Yeah, I mean, obviously this data has only recently been pulled, and which has kind of highlighted this as being an issue that, you know, we're actually recruiting BAME staff faster than we are white staff, but we're also losing them quicker than we are their white counterparts. We are obviously taking action through exit interviews, etc., to look into why that might be, as people are resigning, approaching them to say, are they happy to talk to us about, you know, why that might be. The overarching reason that's normally given is for career progression. Now it's not always to move up quickly within your own organisation, and sometimes a much quicker route of doing that is to apply for a job somewhere else. Whether those are the real reasons for people leaving, that's why we wish to talk to them, because they'll maybe open up rather than giving just a sort of a passive headline reason.
Thank you.
Can I ask a question, please?
I've been had my hand up for quite a while again.
Okay. I'll go after.
Just a quick question here. I'm just wondering, basically, the retention issue and recruitment and progression, career progression outside of Merton is a better option than career progression inside of Merton, because obviously it's identified in the stats, the percentage of senior staff that earns over 80K are all white. So I hope I'm not picking up that the BAME staff that have been working in Merton for many years, the only way they can get to senior positions is in another borough?
So what the stats do tell us is that BAME staff, a higher percentage of BAME staff take up internal training that's offered than their white counterparts, and that when appointments are made internally, a higher percentage of them are BAME than white. That's still not answering the question as to why we've kind of got this 80k threshold and no one has been promoted internally. So if I look at this most recent appointment, you know, there wasn't an internal permanent staff member that went for that role. So whether there would have been any, because obviously once you get up to that level, it's very, very specific, the skill set, as to whether anyone would have been suitable, either white or BAME, to go for that role from the permanent member of staff, but they didn't.
Can I just make an observation here?
I had my hand out.
Sorry. I can't see your hand. Sorry.
I'm so sorry. Shall I just? Oh, okay. Right. Hi, Liz. Yeah, I mean, it's really interesting what you're saying, to be honest, because if I'm hearing correctly, you're saying in terms of exit interviews for an established organization, you do not now have exit interviews data that you can present to this panel. Is that what you're saying? That's one. Two.
So we've had an exit interview process in place for a long time.
Right.
And everybody that leaves is invited to participate in an exit interview, but most tend not to.
Is it anonymous, particularly for the BAME community? Because we do know that there is a trust issue. I've worked for 20 years in the NHS. I'm aware of that trust issue with engagement and all of that. So that's just a question. If there is, then it's good. But I think it would really be pertinent for the panels to be given that information, or some sort of push anonymously for us to understand why you're not getting that sort of response, particularly from BAME people, why they're not engaging with that process. So that's one. And number two, again, you said the person was headhunted. So the person was headhunted. Sounds to me that in terms of talent management and recruitment and retention, particularly retention, it doesn't sound to me like, and again, I stand corrected, that the council is intentional about promoting internally, because surely there was someone in that post before. And if you're going to be thinking about retention and succession planning, then there should be something in place to work somebody up to that position, whether BAME or otherwise. So for you to headhunt somebody on the outside is clearly sending a message on the inside that even if you've worked there for 20 years, even if you've got a degree, even if you've got all of that, we would rather go outside because it's clear to me that we don't have anybody inside that's suitable. And that's really tough. Is it that you don't have any money to do training to, it's kind of hard. So I can't see how a BAME person could really want to remain there if they don't see that there's career progression, as you have also alluded to. So it sounds like a whole raft of things going on in the council that needs to be addressed. That's just my opinion. But then again, I said I stand corrected.
So the reason why headhunters are used is not to deter internal staff, but it's to satisfy ourselves that actually we have embraced as wide a group of people as possible to come to work at Merton, whether that's internal, somebody that's already here internally, or whether we want to cast our net as wide as possible in order to attract the best talent to come and work at Merton. So what we don't have is an internal only recruitment process, i.e. you would go through an internal process first before you go out to the external market. The only place that would happen is through redeployment. So where we've got staff at risk, those jobs are always staff at risk before they go out to the external market. And that's obviously
I believe in I believe in succession planning. I mean, I keep going on about succession planning for years. I think we should have, that you should be able to train people up to be able to take positions, you know, and go up the ladder. I mean, it's all well and good going out to look for other people, but then, you know, you can encourage people. There are people there who are quite capable of actually doing the job if they've been trained as time goes on. I really do believe succession planning is the answer most of the time. So why do you not have succession planning? Because it says on your report that you don't have any formal succession planning arrangements.
I can't obviously explain why we haven't had it in the past as a formal framework and structure for the organisation, but it is certainly on my team's work plan as a priority at the moment to put a talent management and succession planning framework process in place.
It's also a struggle of getting people as well. Because sometimes you struggle getting, you know, the right person, but if you've trained them up, then, you know, they're just right there for you.
Just kind of following on from what the councillor just said, I don't know whether potentially, Liz, you'd be able to come up with like a 5-step plan on how we can increase BAME representation, whether it's from our current workforce or workforce being brought into Merton Council. I know we have council leader here, Mark Allison. I don't know whether we could potentially do a task force of some sorts. I think this seems to be an issue, and from the consensus from a lot of people on this call, it seems to be a historical issue as well. And I really think if we don't do something to address it, it will continue to be an issue moving forward. And to Councillor Addison's credit, his cabinet is representative of the BAME community, so it is something that potentially I'm sure he would be open to.
So what I would say is probably if you were to kind of pull the report apart, actually probably a 5-step process is already contained within that report. You've got coaching and mentoring, you've got reverse mutual mentoring, you've got training, you've got unbiased training, you've got anti-racism training, you've got career development, you've got talent and succession planning, you've got the approach that we're taking to recruitment, the initiatives that are being explored at the moment around the Rooney Rule and having BAME staff on all recruitment panels. So I think there's a wealth of initiatives in there that are currently underway that will all play out in supporting that overall aim.
Okay, thank you.
Can I just say one last thing, unless there was somebody else who had their hand up?
Go on, Grace.
So from what I see, this is a topic that we keep revisiting. It looks like year after year after year, almost bordering on saying that the council has some sort of institutional racism going on. I'd hate to say that, but I know that we've tried to start to readdress some of those issues, such as with the unconscious bias training, which looks like hasn't yet been implemented, even though my understanding was it was to be rolled out with immediate effect.
Yes, sorry, it is already. Not everyone's been through it, but it is in train. It's rolled out. People are attending it.
And it'd be interesting to know what that's looking like. And when you say people, I'd love to know what percentage of your staff have gone through it. What are their thought processes? What's the next steps? What's the plan to really make sure this is rolled out, throughout the whole council? Because you see, it's very, very important. And the reason why I say this is crucially important, for somebody like myself, who is a senior member in the city as a director, what we've seen within in my organisations, and I work for several of them in town, is that creativity gets stunted when you don't bring in a diverse group of people. The organisation becomes less inclusive, and therefore you start not to represent truly the people who you are there to represent. So this is something that needs to be taken extremely seriously. It needs to be addressed like now. And I think, you know, you said a very important role involved 3 people being on the interview panel, I think is poor. And also, it just feels like that is set up for failure already. You're not going to be able to recruit fairly if you're highly bringing in people that are looking more like you. So because we know that when you're recruiting, you can't help it. You gravitate to what looks like what you recognize yourself in the mirror. And so there is also, so already there's a big disadvantage within the recruitment process. So I think really we need to go back to the drawing board on this. And headhunting is one thing, but really we need to sit down, or the council, I say we, I'm not part of the council, I'm happy to come in and help as an independent, but the council needs to go back and seriously look at how it is recruiting. Because yeah, I mean, something has gone dreadfully wrong. And if you're struggling to even retain within the BAME community, there is definitely a problem. And I think there needs to be some candid honesty in terms of what is actually going wrong. Otherwise, we're going to have this conversation next year and again the year after, and nothing's really going to change.
So maybe I could just clarify one point. When the report says that there's a higher percentage of staff, BAME staff, that are leaving as opposed to white, we're talking 1 or 2%. I'm not talking large numbers. So I wouldn't want to alarm you into thinking that it's some mass exodus of BAME staff, because it's not. I mean, the percentage is tiny, but if I was describing it, it is a larger number.
But okay, do you understand what I'm saying in terms of creativity and being more inclusive? Why there starts to be a hole?
I understand your point entirely. Yes, absolutely. The other thing I would just add in terms of the recruitment for the AD post was, obviously they go through a stringent interview with the recruitment agency, but they also go through a stringent interview with the technical assessor. So that's another layer of interview process they go through before they even get to the interview panel. And there was also a stakeholder panel, of which Bob Whitehead, I think he's now left, but Bob was on that panel. He was representing the police force as a stakeholder.
Wonderful. And out of the 50%, because you said in the last phase, 50% were of BAME background, were there any that came close to being second, you know, like a runner-up potential recruit, perhaps? I'm sure you picked the best man for the job or the best woman for the job ultimately, but did you see any from the BAME that would have been potentially a strong fit?
Yes, one of the BAME candidates, if I put them in a ranking order, would have been second.
Thank you.
Okay, thank you. I would like to call on the leader of the council to give a few words regarding that topic. Mark?
Yeah, thank you, Marcy. And actually, more broadly as well. Sorry, I'm the new leader. I've been in place for 2 weeks, and it's been a real experience and a great opportunity to meet lots of people from all over Merton, from all the communities, and it's been really, really fascinating to sort of sit here and listen to you guys. I know sometimes in politics you want to be sort of like shouting from the front, but I thought it'd be really useful to listen. That's the approach that I wanted to take. And I should explain, like, you know, from a personal point of view, my wife and my son are Black, and it's this whole topic of how people are represented and treated in society. You know, the discussion we had with the police earlier, you know, with a young son who's of the age where you know, police might be interested in him. All of those things touch on me very personally, and the things that I really, really care about. And there's obviously a number of things that we need to work on, and I want to reassure you that these are really high priorities for me. In setting up my cabinet for Merton, half of my cabinet are Black, and I thought that was really important. sends out a message that there are some fantastically talented people from our community who are not white and who can do a good job in our community. So that's a starting point. In terms of recruitment, I think what we need to, it's very, very frustrating. It's very frustrating for people with who know young people who are, who are Black. You want them to have the same opportunities to progress that people like me have had, and that is something that I'm absolutely committed to improving. But with recruitment, it's also a slow process as well, and that's what makes it partly frustrating. Over the last 10 or 15 years, there have maybe only been about 2 or 3 appointments at the very highest level of Merton Council. And so it takes a long time for people to progress in their job, to get higher, and then to get to these positions. And we need to work towards it. And that's why it's crucial that in this next application round, we employ a recruitment consultant that will address the need to put Black candidates on the shortlist. And we will need to make sure that there are Black people on the panel that will be interviewing them. And obviously, if at the end of the day, the best person to be appointed is whatever colour they are, we need to appoint the best person, because we need to look after the interests of the residents of Merton. But you would hope that by creating those opportunities over, not necessarily the first time, not necessarily the second time, but eventually the third or the fourth time, we will be getting people in who better represent the community and are more like the cabinet that I've established, and are more like the people of Mitcham, Morden, Wimbledon, Rains Park and so on, who are very, very different looking to the long established leadership team of Merton Council. So it's very important to me, and it's been really good to listen to you and the strength of feeling that you have, because it really does help me to lead the council in the future. So thank you.
Yeah, can I ask a quick question, please?
Go on.
How do we or how does the local authority ensure that any recruitment agency that's one they are using has the same exacting standards in terms of their race or equality and diversity? So
So the headhunters are asked to submit a proposal, and in that proposal they have to articulate their approach to equality and diversity, how they would make sure that they're approaching candidates from a wide diverse field, but in particular encouraging people from BAME communities to apply for the role. We look at their track record of making similar appointments, how they've done that, who they've done it for, at what level, and how many of their of those candidates that they've put through, how many were at the long list, what percentage were BAME, what percentage at the short list, and whether a successful BAME candidate has gone through to get the role. So they all have to articulate those kind of facts and figures in their proposal.
Thank you. I have a question.
Thank you.
Is the unconscious bias training mandatory?
Yes.
Sorry?
So yes, it will take a while for everyone to go through it, but yes.
Can I ask one quick question if possible?
Go on.
Thank you very much, Mark Allison, and congratulations on being selected as the new leader of the council. So, and I think you're doing a brilliant job at the start in reflection of who you've selected already and split the panel so that there's a reflection there of, like you said, 50%, and identifying that obviously your wife and children are Black. But one of the things I would love to address is the fact that Merton has a 100% record, and that's retaining the white candidate at the top echelons of the roles in the borough. In the 20 years I've been here, that 100% record stands. When do you think that might change?
Sorry, was that Fitzroy asking the question?
Yes, it was Fitzroy.
Thank you, Fitzroy. You're laying down a challenge to me. I can't promise. We, you know, you've been here for 20 years, and I think it is 20 years since we've had a black member of the senior directors team in Merton. And for me, having spent my life living in London and knowing what London looks like, you know, that is not something that I'm very happy about. But in the last 10 years, whilst I've been on the cabinet, I think there have been just 2 or 3 changes on the cabinet, maybe just 2, on the amongst directors. So there haven't actually been as many opportunities to make those changes as we might have wanted. It's one of the good things about Merton I've been talking to people about, is that Merton is a good place to work. I hope Liz would say that our staff like working at Merton, and there is a relatively low turnover. So therefore, the amount of time it takes for new people to come in is longer as a result. But when each time there is a new place becomes available, it is a challenge to us. First of all, it's a challenge to get people to apply, and we need to really pressurize, you know, the headhunters, the recruitment agencies, and their own internal staff to apply for jobs. And if they apply and they're the best, and we hope that they would be the best, then they will be appointed. So you're setting me a challenge. I can't promise when, but I am very, very hopeful. It's happened in the past, and I hope it will happen in the future.
Thank you.
Thank you very much for that, because the BAME population has changed massively since 20 years ago.
Oh, I know. I've been here, I've seen it. Don't worry about it.
Any other questions?
Yeah, I've got a question, but not for Mark, it's for Everett. You know, the stop and search panel that Bob says there is, do you think you can get the details and pass it on to us so we can pass it on to the community?
Yeah, there are a number of things from Bob's presentation that I'm going to follow up on and share with the JCC.
Thank you. Thank you very much.
Okay.
Thank you.
Well, we move on to item 8. Any other business?
Sorry, Chair, I have an AOB. I've been contacted by someone from the Office of National Statistics. He is supporting the borough for next year's census. The census will take place in March 2021. And what the ONS are keen to do is to do outreach work to BME communities. He's just sent me something, so I'm going to draft it and send it out to JCC members. And what I'm doing is encouraging organisations to share it with all your community and all your volunteers and so forth, just to make sure that we do capitalise on increasing the number of people who respond to the census. I know that there's some distrust historically, but the higher numbers that we can register, that will help the council in terms of the subsidy that comes from the government. And often if we undersell because we don't have the numbers, then we're actually not helping ourselves. So it would be really good if we could, you know, try and increase the numbers for the BME community response. But I will follow up after this meeting.
Okay.
And sorry, the gentleman's name is Matthew Hopkins, but I will send an introductory email to everyone so that if you're approached by him, you're not sort of wondering who this person is.
Okay.
Can I ask a quick question around census?
Okay.
That's Fitzroy.
Yeah, just a quick question, was the 2011 census data used to fuel Windrush?
I can't, you're talking about from a government perspective.
From a government perspective, not you personally.
I can't respond on the government perspective, but the thing about the census data is used for a lot of things, but it gets out of date quite quickly. So for us in the council, we use the GLA projections, and there are a number of data sets that we use, but it might well have been used, but I can't confirm that.
Well, the reasons I have asked that question, the new census that's going to be taken, I know we've had lockdown round 0.2. I'm concerned we may have Windrush 0.2 based on the new census data, because it does count the numbers. It does make sure because I've been on the census report and breakdown that identifies quite clearly in every single borough in Greater London what the BAME breakdown is in every single borough. So, so for me, there's a concern for the BAME community of how the census data might be used to take advantage of making decisions that would disproportionately affect some of the BAME community. And being a Jamaican myself and hearing the stories of so many being sent home in the context on the Windrush footing is quite concerning for me. So I would love to make sure that that can be clarified, because it may stop people wanting to respond positively to the census that's coming at present. Thank you.
I think that would be a legitimate question to put to the gentleman from the ONS. I'm not sure if you'll get the definitive answer. I mean, that question seems to be something like a question you'd need to make to a member of parliament to ask in parliament questions to the Prime Minister, for instance, because it's that national level. But certainly locally, when you engage with Matthew, then ask him all those questions and he will take it back to ONS and respond as fully as he can.
Okay, thank you very much. Anyone else?
I could just follow up on the census. Next year's census is the first totally digital census. As we know, digital inequality is an issue. It's an issue that has become very pertinent within the COVID era. As such, MBSC has been engaged to provide census support centres across the borough or across the east of the borough. So there will be a support centre to assist residents complete their census forms, online forms, in Vestry Hall, Pollard's Hill and Wimbledon. And the precise details of those will come out in the new year. But also, in answer to your question, Fitzroy, we are legally bound as residents to complete the census. So it's a legal obligation on every citizen.
Thank you, Bo. And again, when you have the information, if you share it with me, I can share it again with this group. Thank you.
Okay, thank you very much. Anyone else? If there is no one else, thank you very much. We have really gone 10 minutes to 10, so I think we had a full night. Sorry?
1 minute, Chair.
Go on.
It's Joan. Yeah, thank you. I just want to say thank you to everyone that I've invited to this meeting tonight. Thank you very much for taking your time to come out. Thank you.
Okay, so thank you everyone for making the time successful, I hope. Well, I enjoyed it. I learned a few things, and please especially with the stop and search, let your residents know about the stop and search panel. That's very new to me. I never knew there was such thing as the stop and search panel. So if you think anyone who have been stopped and searched in a negative way, they can go to the panel. Okay, thank you very much. And I